Hey, this is Dr. Raj Gupta, and I am here to show you how to perform your COVID-19 rapid test kit. These kits will tell you if you have COVID-19, if you had COVID-19, and most importantly, will let you know if you have built up the antibodies. Let's go ahead and get started. As you can see, I have laid out everything in front of me that comes in the test kit, and I've actually opened some things up so that it's easily accessible. Once I am bleeding, I can just grab stuff and I don't have to worry about opening it up. Okay, so first and foremost, you're going to take your alcohol swab and you're going to sterilize the tip of your finger. You want to use your index finger. It's just the most easily accessible on either hand is fine. Once sterilized, you're going to take your lancet. Your lancet, you're first going to remove the plastic cap, put that on the side. You're going to take the fatter end of the lancet, should be pointing up with the narrower end pointing down. You're going to put it right on top of the tip of your finger and then just push down, and you will feel the finger prick, and you will also, once removed, see a droplet of blood. Now, you want to wait and be a little patient here because you want to make sure that you have enough blood for the sample. If not enough blood is coming to the tip of your finger initially, give it a little time, and also hold your hands below your heart, which will help the blood to start to accumulate on the tip of your finger. You're then going to take the pipette included in your kit. Before I do that, I'm going to remove the kit from its packaging. This is what the kit looks like. I'm going to put it flat on the ground. And as you can see, this is where it says S, and that is where you're going to put the blood serum. So I'm still allowing the blood to accumulate on the tip of my finger to make sure that I have enough blood for the sample. Again, patience here is a virtue. You want to make sure that you have enough blood to make the test valid. So again, as you can see, I'm starting to get a good amount of blood. You then take the pipette, you squeeze it first, then apply the tip to the tip of your finger, and then let go. When you let go, you see the blood comes into the pipette. You're then going to take this blood and apply it to the hole that says serum. You can then discard of the pipette, and you can see that the hole is full of blood. You then take the buffer. This is the buffer. You're going to twist off the top of the buffer. And you're going to add 2 drops of fluid right over the blood droplet that you put into the kit. I'm now going to take the gauze. I'm going to wipe off any excess blood on the tip of my finger. I'm going to take out the bandage and apply that to my finger to stop the bleeding. And you're now done. You want to wait. As you can see, I don't know if you can see it there, but there's a coloration that's coming on, or a graph that's forming. And eventually what you're going to see is there's going to be a line that appears at the letter C. Once that happens, just leave your kit for 10 to 15 minutes. You can use a timer to check your time and come back, and when you come back in 10 to 15 minutes, you're looking for one of 3 lines. You want to have the C line there. That means it is a completed and valid test. If no other lines show up, the test is done. If a line shows up at IgM, or a line shows up at IgG, or a line shows up at IgM and IgG, you then go to your kit, you look in the back of the instructions, and you will be able to interpret the results. That is how you are able to perform your rapid COVID-19 test kit. If you have any questions, please call us at Soul Focus at 732-935-1000. And again, these test kits can be purchased on our website at www.soulfocus.com.